Hello, my dear friends. It turns out that world sales of antibiotics reached a fantastic figure of $50 billion. And we all, wishing it or not, sooner or later become participants of this market. It's no wonder that each of us has a lot of questions concerning antibiotics, and today we'll try to answer some of them. Well, my dear friends, please raise your hand if you've never happened to use antibiotics in your life. Oh, we have none. So my words that we all, in general, are the participants of this market are justified, aren't they? It's no wonder that there are a lot of questions. We have already done a lot of programs about antibiotics. It means that our regular viewers, attenders of our school, are abreast of that. Nevertheless, I still believe that you must have some questions. Let's try to answer at least 10 of them today. So questions. Great. It's always nice when men start. Hello, Dr. Komodowski. Please tell me, what is the probability of antibiotic-resistant bacteria appearing after a course of antibiotics? Well, there is always a probability, but this probability is closely connected with our enthusiasm. The more we use antibiotics, the more the possibility of bacteria appearance. That's the thing. But also important is the correct dose schedule, and the second is the duration of taking the medicine. Parents very often believe that it's better to give less, because big doses are dangerous, and so on and so forth. We were prescribed the whole pill, but that's why I better give my baby a third of it. There's one thing you need to understand. The more the concentration of the antibiotic in the body tissues, the less the risk of appearing antibiotic-resistant bacteria. Exactly, small doses, short course treatment, frequent usage of one and the same antibiotic increases the possibility of antibiotic-resistant bacteria appearing. Hence, accordingly, we apply some preventative methods. First, and the main method, is not to stuff your baby with antibiotics just when you feel like it. Don't take antibiotics for prevention, and follow the dosage and duration of taking strictly. Thank you. Other questions? Hello, doctor. Could you tell me, are antibiotics necessary when we have a heavy cold? Well, people think that if you have something heavy, you need to see a doctor so that he could give you something strong. A strong medicine. Antibiotics, of course. Although, what type of infection is runny nose in 99% of cases? Viral. That's why heavy cold as a rule is almost always what? Contraindication of antibiotics. Nevertheless, I want to draw your attention, always, when you complain of a certain symptom, which is, as you said, heavy ache, heavy itching, heavy nose, what do you need to do? Go to the doctor. Well, when it's just a slight symptom, you can deal with it yourself. Yes, please. Hello, doctor. Please, could you tell me, is a regular sore throat ground for taking antibiotics? Please. Keep in mind that first, always, when there's a sore throat, the first question you need to ask yourself is if there's a runny nose. If there's a runny nose, the sore throat with a high probability is a result of what? Viral infection. It is not a big deal. However, if we have a sore throat but no runny nose, then, with a high probability, it is a bacterial infection, more likely caused by a microbe called streptococcus, which definitely requires an antibacterial agent. Therefore, sore throat is always dangerous and a prospect of considering antibiotics for it. If there's a sore throat without a runny nose, you need to see a doctor urgently. Keep it in mind. Good afternoon. Could you tell me, please, whether we need antibiotics for otitis or not? Look, otitis in itself is not a direct indication for antibiotics use. There are a lot of nuances. For example, age. Not a single person, not a single doctor in common sense will treat babies under 6 or 12 months of age for otitis without antibiotics. And by the way, this age period is being reconsidered all the time. In one country, they use antibiotics right away for babies under 6 months old. In other countries, they use it for babies under 12 months old. It's a cultural thing, I guess. This is the first thing you need to remember. The second is that you need to know the terms of otitis appearance during a viral infection or what's caused it. For instance, you were flying and an unfortunate landing resulted in otitis. You were diving and got otitis. Or you had sniffles. Sniffles. And then otitis. At the same time, you had high fever and an earache. To cut a long story short, the main thing is suddenly a sharp earache occurs when there's a viral infection. You have 2 to 3 days to watch and wait and provide so-called symptomatic treatment. Antibiotics, anti-inflammatory drugs, ear drops, nasal drops. If there's no improvement within 2 or 3 days, then you definitely need antibiotics. To sum it up, you urgently need antibiotics for otitis in babies, especially under 1 year of age. In all other cases, 2 to 3 days of watch and wait are possible. No improvement, you definitely use antibiotics. Clear?
Здравствуйте, доктор.
Hello, doctor.
Нужны ли антибиотики?
Do we need antibiotics for green and yellow mucus? In fact, you know green mucus or yellow concentrated nasal mucus, in addition that it smells badly, can be one of the symptoms of inflammation of the paranasal sinuses. That means enteritis, bronchitis, sinusitis, and so on. Smart words, aren't they? However, if a child has these diseases, they are found not just with green mucus only. There must be high fever, intensive pain. Long story short, green mucus and big enthusiasm are not causes for antibiotic treatment. Green nasal mucus with general malfunction, worsening after improvement, and high fever are the reason for what? No, not for prescribing antibiotics, but doing a clinical blood analysis and bringing your child to a doctor. Yes, to a doctor, who will make the right decision.
Клинически и показать ребенка кому? Доктору, который примет решение.
I want to draw your attention that when we ask a question, if we need antibiotic for enteritis, if we need antibiotic for green mucus, the formulation of each question is wrong. Just as if you asked mother this question. The thing is that all these symptoms, earache, green nasal mucus, are the symptoms indicating that you might need antibiotics. And who do you need to see then? A doctor. The main rule is that between antibiotic and a child taking antibiotics should not be only mother, but mother and a doctor, who together with her will make the right decision. Good. Yes, questions? Hello, Dr. Komorovsky. Tell me, please, when URTI, is it necessary to wait for complications bacterial, or can we give antibiotics right away? As I can see, this idea is always on your mind. The main question is whether there will be complications after viral infections or not. So why not prescribe antibiotics at once for prevention of complications? Medical science gives a definite answer to this question. Antibiotic prescription has no prophylaxis efficiency. So antibiotics can heal bacterial infections, but cannot prevent them. Moreover, antibiotic prescription for viral infection increases the possibility of bacterial complications. It is according to medical science. Nevertheless, in many countries, even in civilized ones in the US and UK and other European countries, a lot of people complain that many doctors prescribe antibiotics only for slightest sneezing or viral infections, supposedly in order to avoid complications. I want to tell you that this happens not because doctors don't know what medical science says. That's because they are afraid of lawyers and attorneys more than medical science. Because later, when a complication appears, it will be hard to prove that there was none. But it appeared later, and the doctor missed it somehow and did nothing. And it happened not because of him. By that way, he did everything he could. He prescribed everything that was at hand, but it happened. What happened? So it's no one's fault. That's why we come across antibiotic prescription for viral infection here and there, which is an attempt to avoid responsibility. Everyone avoids it. And these people who take antibiotics, they just suffer from it. And those who produce antibiotics are only happy about it. Can I ask another question? Of course you can. You know, abroad there are such tests that check whether to give antibiotics or not. Is there anything like this in our country? Well, first, in fact, there exist test strips which can detect the activity of some bacteria. like streptococcus, in saliva. With the help of such tests, we can define if angina or a viral infection is the reason for sore throat. However, there's another more reliable, very efficient test called common clinical blood analysis. Although such test strips are already sold in our country, you need to tell your doctor that they are being sold in our drugstores, and you just need to go and buy it. Again, parents can have such test strips at home, and they can find on the internet how to use them. Anyway, we have such opportunity. People, I'm sure that the questions about antibiotics can theoretically go on until morning, and not necessarily the nearest morning, right? Nevertheless, we will return to this matter, and so far we have a lot of interesting subjects ahead.